This is Taylor Welch presenting for Foundations of Nursing, Module 6 assignment. I couldn't find anyone to help me with my project, so I have my cat, but basically I would go into the room, monitor the patient. Oh, here, let me do the scenario first. So I chose scenario number 3. Margie Colby, a 25-year-old primipara, is in the recovery room after a low forceps delivery of a 9-pound, 2-ounce term male. Although this was an unplanned pregnancy, Margie and her husband adjusted to the idea and are now very excited parents. Margie plans to breastfeed the baby. 45 minutes after delivery, Margie's vital signs are blood pressure 100/60, pulse at 88, and respirations are at 16. Her fundus is firm and is at the level of the umbilicus. No clots observed. She has continuous trickle of bright red lochia, no change in perineal edema. Ice pack applied and peripads changed. Peripads and Chuck's weight indicate 300 cc's of blood loss. And then 15 minutes later, the fundus is massaged and remains firm at umbilical level and midline. A constant trickle of bright red lochia persists and no clots are expressed. Peripads and Chuck's weight showing an additional 200 cc's of blood loss. Vital signs are now blood pressure 90/52, pulses at 110, and respirations are at 20. So based off that information, I would probably be the nurse, hopefully taking both measurements. There's quite a big difference between the first vital measurements taken at 45 minutes, and then between that and 15 minutes later, there's quite a difference. So based off that, her vital measurements are falling below the normal healthy range. I would begin abdominal massages, trying to get the fundus, to move a little bit. And then I would page the physician on duty, and if the physician was not responding to my pages, I would go ahead and give him a call. So, hello, doctor. This is Nurse Welch calling about patient Margie Colby in obstetrics. I'm in room number 3. Mrs. Colby is exhibiting possible signs of postpartum shock and hemorrhage due to her vital sign measurements. It is currently 0600 at the time of the current patient's vital measurements and blood loss. The patient is not currently on any medications and has no allergies. Her respiratory rate is increasing and on the high side of the normal range at 20 breaths per minute, which has increased 4 breaths per minute from her last measurement. Her pulse is out of normal range and measuring at 110 beats per minute. Her blood pressure is low at 90/52. She's also losing about 500 cc's of blood per hour, which is on the high side. And the patient is primipara. My assessment of this patient is that she may be experiencing stage 1 postpartum shock and hemorrhage due to the rapid decline in her vital signs and the accumulating blood loss. I recommend that you see the patient immediately to locate the site of the bleeding and repair the possible damages. I would like to administer the patient 0.2 milligrams of Methergin intramuscularly, increase the oxytocin and IV fluid that she's getting, empty the bladder with a catheter, and start the patient on 2 units of packed red blood cells. Do you agree with this? And then I would listen yes or no and continue my treatment for the patient based off of what he either concurs or disagrees with. Thoughts on the scenario. The patient was around the higher end of normal range measurements for some of her vitals, like the blood output and the respiratory rate. However, because of her blood pressure and heart rate, she was still in normal range for those, but with her blood pressure being really low and her heart rate being really low, I think it's important to contact the physician immediately because she is a first-time mother. And if the bleeding is stopped faster, she's going to have less instance of needing a hysterectomy to repair the bleeding. And then obviously, if she doesn't have a hysterectomy, she has a higher possibility of being able to have more kids later on. Additions. So with this patient, there were certain vital signs that were not listed in the scenario that could be beneficial for monitoring just overall health of the patient and decline, like temperature. If she had a really low temperature due to her low blood pressure, that would make sense. Or if she had a high blood pressure, she might be getting an infection. Temperature is just necessary to have. Oxygen rates measured. I mean, she has really high respiratory rate, so oxygen measurement should be something that would be included, I think, with respiratory rate just to see what's going on there. And then urine output, because a lot of the times with postpartum hemorrhage, it can be bladder atrophy, which, has a lot to do with urine output. So those could all be included in the scenario and then added to the SFAR just to confirm that the patient is in total decline. Non-necessities of the SFAR, I mean, as far as the SFAR go itself, I can't really think of anything that I put in there that's not necessary. I think the purpose of the SFAR is to compile the most necessary information in a very concise and organized manner so that it helps the physician understand the level of the emergency just in as little as time as possible, because they could be getting possible phone calls from other patients. They need to triage mentally and figure out, who is the most emergent situation. And, sometimes they might know more about it than us and be able to say, that's not necessarily an immediate emergency, that can wait a couple hours, and then, update me on the vital signs, and then we'll decide if it's an emergency. In the scenario itself, though, I think there's a lot of information that's listed that's not necessary. I mean, initially I thought that the patient being listed as prima para was not really important, but it can be when you consider the fact that prima para patients are more inclined to hemorrhage because it is their first pregnancy. So it is somewhat important information to have, and I think that also adds a little urgency to repairing the damage of the patient. She is a young woman with her first child. The likelihood that she wants to have another one is pretty great. So it's just in the best interest of the patient that we tend to her as quickly as possible. We don't want her to bleed out either. She needs to mother her child. However, I think unimportant information in the scenario was, like the sex of the baby. It being a male is not really important. The fact that it was delivered with low forceps could be important because it could indicate like where a tear might be. The fact that it was an unplanned pregnancy is not important. Excitement from the parents, not really important. The decision to breastfeed the baby definitely doesn't need to be discussed in the emergency situation with the physician. If the scenario was to be presented again, I would include the patient's temperature, oxygen level, and urine output, given that those things would be included in the scenario. And then I would obviously leave out any personal information, again, that would be presented that's not emergent information for the physician to have. The temperature, oxygen, and urine output are likely going to be also good indicators that are concurrent with her current measurements that kind of say that she's going into postpartum hemorrhage or shock. And it just furthers the solidity that the physician does need to tend to her immediately. Was the significance clearly presented? I think that the severity of the situation was clearly presented because this mother is, even though only 1 hour after birth, she's rapidly declining in her vital sign measurements. And the rapid decline can be seen between her 45-minute measurements, which were not really bad, and then 15 minutes later, we're getting out of range for healthy vital sign measurements. And so obviously tending to the matter quicker is going to give her a better outlook because she does have an uncontrolled bleed somewhere. overall, we obviously want a healthy mother that can provide for her healthy baby and for her to have the option to conceive again. But the decision overall isn't even just to help the mother. It's also, with the father and the baby in mind. When you take care of the mother, you're taking care of the whole family. They obviously depend on the health of the mother to take care of their family and provide for their baby in the best way that they can. So, yeah, I think I answered all of the questions, and I included a Word document with all my references and a little written script. So, thank you.